Hello, hello. This is Dr. Jesse Ritter. Today's topic is going to be on chronic tooth degradation. I'm going to talk to you about what it is, why you have it, the consequences of not treating it, and then how we actually go about treating it. So, chronic tooth degradation. You've probably never heard of it, right? It's more commonly referred to as tooth wear. The reason I call it chronic tooth degradation is because it's slow. Most of the time, it's slow. And so it's one of these things that it goes undetected because most of the time, there's not pain associated with the wear. Things that happen slow in the human body oftentimes are like this. They go undetected. Think about gaining weight. There's no alarm bells that go off as you gain weight, but you become more and more unhealthy. Same thing goes with your teeth. Diabetes could be another example. Heart disease could be another one. These things that happen slowly tend to go undetected. And so a lot of times, people actually come to my office and they're unaware that they have this occlusal degradation, this tooth degradation. So I define it as a slow process that often goes undetected, but it results in a lot of times pretty extreme wear of teeth. So, why is it there? Let's ask that question and get that answered right away. So, what causes it? Well, wear is caused by a lot of different things. Wear is one of these things that is multifactorial. One of the big things that can be involved with wear is sleep apnea. So obstructive airway disorders while you're sleeping actually cause you to clench, grind, kind of thrust your jaw around in an effort to breathe. All happens unconsciously. And so that can result in a lot of destruction of teeth, and sometimes that can actually happen rapidly. But again, a lot of times it's chronic, it's slow, and therefore you don't have a lot of immediate symptoms. There's not something that's just jumping out at you. The alarm bells are going off. So it could be a sleep issue. Okay, another thing that it could be is it could be a chronic stress issue. People that are chronically stressed, clenching, grinding a lot, sometimes even during the day, but sometimes in their sleep, people that are stressed out, they tend to have elevated cortisol levels, which can lead to increased grinding and clenching. So that can be a cause as well. And then, of course, there can be the third thing, can be a fundamental disequilibrium, if you will, of your bite. So your bite is uneven. Your joints, your muscles, and your teeth are not functioning in harmony. So there is a complex interplay that happens there between your joint, your muscles, and your teeth. And if they're out of whack, what ends up happening is the teeth and the joints always lose. Muscles can replenish themselves. They can flush themselves out if lactic acid builds up. They can show up the next day and they can continue going and going and going. They may be sore, but they can keep working. And so what happens is your joint, which is something that doesn't have the repairability that your muscles do, your teeth also don't have that repairability. Once the two structures worn away, it's gone. They lose. Okay, and so if there is a disharmony there, most of the time the manifestation that we see is going to be the teeth, right? And so this happens over a period of years usually. It's not something that happens over weeks. And tooth wear is one of those things too where there's a common misnomer out there that tooth wear is normal, and so people will look at their teeth and say, oh, they're starting to look a little bit, edges that used to be round, they're starting to look flat. I'm noticing that my front teeth are starting to look a little bit squarish from the wear, but that's normal. Or sometimes they look at them and they really know that they're worn, but they believe that because they're 60, 65 years old, that's just part of getting old. And the thing that I want to impress upon you is that getting old does not mean that your teeth have to wear. There's a very, very tiny amount of tooth wear that is actually within normal limits, and that is it's 1 micron a year. But when you think about that, how that compares to something that we can relate to, if you take the average thickness of a thumbnail and you stack 2 of those on top of there, okay, that equals 1 millimeter. Well, 1 millimeter is 100 microns, which means it's going to take 100 years to wear 2 thumbnail thicknesses of your tooth away. So if you're looking in your mouth and you're noticing there's more wear than that, or you can visibly see it, there's something that's at play there. There's something that is off. So the thing that frustrates me so much about this chronic tooth degradation is the fact that there are no symptoms. There are no alarm bells for patients, and sometimes it's a tough conversation to have. One that usually involves taking photographs. So how do we diagnose it, right? We take photographs, we do an in-depth examination, and we feel your muscles and see how they're doing. We examine your joint, and we kind of put all these puzzle pieces together. And sometimes people are having symptoms, and sometimes they're not. And that's the tricky thing of it. Now, anytime we're working with front teeth, be it cosmetics or repair of wear, we have to factor in the whole system, and that's something that's very important. That's why the diagnostics up front are incredibly crucial to the end result. So, chronic tooth degradation. Yeah, it's one of those pain in the butt things, that a lot of us have, and a lot of us know we have it, but a lot of us don't know we have it, and a lot of us don't know what the consequences of it are. So what I want to do is, the last thing here is, I do want to review what the consequences are of not treating this chronic tooth degradation. And as you can imagine, we'll start with the first one, which would be simply that the wear is going to continue. So if the wear is not addressed, the force is not mitigated, then the tooth degradation is going to continue. And it continues at different rates for everybody, but no doubt it will continue on if nothing is done about it. And the thing with as it progresses is that as tooth wear progresses, once you wear off that enamel on the surface of your tooth, which everybody's got about 1 millimeter to 2 millimeters of enamel, I know that's a little technical, but it's there's not much, and it's coating all of your teeth. And once that is worn through, now you're into the softer core of your tooth, and your teeth are going to wear anywhere from 7 to 10 times as fast. So this process only picks up speed over time. So the longer you wait to intervene, really that's the main consequence of not treating it. I would say a second consequence would be, yes, the teeth can continue to wear. That's one way that things can degrade, but things can also degrade. The excessive force can actually cause bone loss around your teeth. It can cause things to crack, chip, fracture, things like that. So as time goes on, the consequences only become more harsh. The treatment only becomes more extensive. So the sooner we can intervene, absolutely, unequivocally, 100%, the better. The less it's going to cost you, the less time in the chair it's going to involve, the less involved the treatment is going to be, and the more predictable the outcome is going to be. So this sneaky disease, it is a disease, this sneaky disease, the sooner it's diagnosed by somebody who's trained to diagnose it, and then the sooner it's intervened with, the less problems you're going to have down the road, and just the happier and healthier you're going to be over the course of your dental life. So, how do we treat chronic tooth degradation? If you've had damage to your teeth already, how do we go about turning back the hands of time and rebuilding that wear in a way that it's going to last? So first off, the best way is typically to restore what's been lost using a combination of either composite or porcelain materials. Now, sometimes, because when teeth wear, they actually move around, sometimes we actually have to move the teeth back into position first, either with clear aligners or actual braces as well. But by and large, that is the way that we actually rebuild that wear. We actually physically restore what has been lost on your teeth. And in some cases, like I said, we have to reposition the teeth prior to that to get them back into their proper position. Because what happens is, as teeth wear against each other, notice that there's not space there. There wouldn't be space there between the teeth. They stay together. But what happens? Imagine the teeth have actually been shortened that much, but the teeth actually erupt together and stay in contact, right? So we have to put them back where they belong and then restore that wear in between. So that's how that whole process works. So that's how we actually treat the wear once it's already happened. And like I said earlier, if we wait until things have been wearing or been badly damaged for a long period of time, that treatment tends to be more involved. It tends to be more likely that we actually have to move your teeth first before we can restore them. It becomes more likely that we actually have to cut more of your tooth structure to be able to restore your teeth properly. Sometimes we actually have to open your bite up in order to restore your bite properly. Thank you so much for tuning into this video. If you found this information helpful or useful, I'd love for you to like it and share it with anybody else that you think it could help. Thanks a lot. I'll see you on the next one.